Welcome to DOKDEE.com. I am Dr. D and I will be your doctor for today. On today's episode, we'll be talking about cuts and grazes, minor wounds. Those are the type of injuries that heal within 24 hours that don't require urgent A&E management. But we'll also be touching on red flags that require you to seek further medical attention. So how do we treat minor cuts and grazes? The first thing is stop. Don't panic. Stop the bleeding. How do you do that? Use a clean, dry towel or handkerchief to apply pressure to the wound. If the cut is on your hand or on your arm, elevate the arm above the level of the heart. If it's on your lower limbs, you can sit and you can elevate the limbs. Once the bleeding has stopped, you may clean the wound and apply a sterile dressing. Exactly how do you do this? Run the wound under clean drinking water. Avoid using antiseptics as they may be more corrosive to the wound. Do not rub on the wound when you're cleaning it. Tap it dry and then apply a sterile dressing. You may change the dressing perhaps maybe twice a day. Once it starts drying and scabbing. If you need pain medication, you may speak to your local pharmacist or your healthcare provider to make sure which medication is most suitable for you. So when is it that you actually need to seek medical attention? Those wounds that are deeply contaminated with grass, glass, name it. Those wounds that just cannot stop bleeding. They've got jagged edges, they're longer than 5 centimeters, animal and human bites, and as well as deep wounds to the face and to the hands. What are the red flags of an infected wound? This is when the wound is red, it's swollen, it's inflamed, it's painful, there's pus oozing out of it. You may even have serous fluid coming from it, which is straw-colored kind of fluid. You may have reduced sensation around the region, or you may have pain that's prohibiting you from moving that limb. You may be spiking temperatures, you may have swollen glands to the region that's closest to the wound itself. Then you definitely need to seek medical attention. When you're in the emergency room, the doctor will thoroughly irrigate your wound, meaning clean it out quite nicely. They may or may not even stitch the wound, depending on how contaminated it is. Not all wounds require stitching. Sometimes closing it may be more detrimental. If the wound is on the face or the hands, they may call in a plastic surgeon or a hand specialist to come and assess the wound. You may require antibiotics or a tetanus shot. If you've been bitten by an animal, they'll do a rabies screen for you and see if you require anti-rabies medication. So it's sometimes important to see if your wound requires further management within the A&E. Ichoo! Guys, unfortunately that brings us to the end of today's episode. If you really liked it, please press like, share it with friends and family, comment in the comments box below. If you want more information on today's episode, please be sure to check out our social media pages and as well as our website. Up until next time, please be safe. Toodles.